Just to let you know, I do have anxiety, so I do tend to get a little bit shaky.
If you're a legally prescribed medical cannabis patient in the UK and police suspect impairment, you may be required to undertake a Field Impairment Test, known as a FIT. This procedure is governed by the official Field Impairment Testing Code of Practice. It is structured, it is standardised, and officers must follow it.
The first one is I'm going to examine the size of your pupils, comparing them to this game. Which means I'll hold this up to the side of your face. I'll require you to look straight ahead, keep your eyes wide open. Do you understand?
Under Section 6 of the Road Traffic Act 1988, police can require a driver to undertake a preliminary impairment test if they have a reasonable cause to suspect impairment through drugs. The procedures officers follow are set out in Section 6 of the Field Impairment Test Code of Practice.
Stand up straight, with your heels and toes together and your arms down by your sides, like this. Sit, maintain that position whilst I give the remaining instructions. Do not begin the test until I tell you. When I tell you, I want you to tilt your head back slightly and close your eyes. So as you are now, arms down my side, head back, eyes closed. Okay? When I tell you to begin, tilt your head back slightly, close your eyes, and then when you think 30 seconds has passed, bring your head forward, open your eyes, and say stop. Okay? So, when you're ready? Go.
Stop.
Okay, how long was that? Okay, second one, third one rather, is going to be the walk and turn test. Okay, so we're going to have, there's an imaginary line down the road that we're going to walk along.
Before conducting each test, the officer must explain the purpose of the test, give clear instructions and demonstrate where appropriate, and ask whether you have any injury, disability, or medical condition that may affect your ability to perform the test. This is extremely important if you have a balance condition, a neurological condition, a mobility issue, anxiety affecting performance, or you are prescribed cannabis-based medication. You must declare it clearly. The code requires officers to take any declared condition into account when making their overall assessment.
When a ninth step has been taken, you must leave your front foot on the line and then turn around using a series of small steps with the other foot, which I will demonstrate in a second. After turning, you must take another 9 heel-toe steps back along the line. And during the test, you must watch your feet at all times and now count each step out loud. Once you've started walking, do not stop until you've completed the test. So, as I said, it's going to be no. Okay? So, do you understand me? Do you have any disability or medical condition that prevents you from participating in this test?
The Code of Practice sets out 5 standard tests: pupil examination, modified Romberg balance test, walk and turn or heel to toe, one leg stand, and finger to nose test. These are designed to assess coordination, balance, time perception, and divided attention.
Next one is called the one-legged stand test. So what I need to do is stand with your feet together and arms down by your side. Sit like that, same as before. Maintain that position whilst I give you the remaining instructions, as you do not begin until I tell you. Do you understand? When I tell you, you must raise your right foot 6 to 8 inches, 15 to 20 centimetres, off the ground, keeping your legs straight and your poised toes pointing forward and your foot parallel to the ground. So as you are now, like that, foot out, horizontal like that. Okay? Now that high off the ground. You must keep your arms down by your sides and keep looking at your raised foot whilst counting out loud in the following manner: 1001, 1002, 1003, and so on, until I tell you to stop. Do you understand? Do you have any disability or medical condition that prevents you from participating in this test? So if we go with the left leg first.
If you are prescribed cannabis-based medication, say clearly, "I am prescribed cannabis-based medication and have taken it as directed." Impairment, not mere presence of THC, is the key issue in this assessment. Even with the prescription, it is illegal to drive while impaired. However, lawful patients who are prescribed legally, taking medication as directed, and not impaired have legal protection under the statutory medical defence provisions of UK law.
Okay, the next one is it's a finger and nose test. So what I need to do is stand again with your feet together and your arms are going to be in this position. And this time they're going to be out to the side.
Like this.
That's it. Yeah, with your feet, index finger pointing out. So and that's on both hands. Maintain that position whilst I give the remaining instructions. Do not begin the test until I tell you. When I tell you, you just tilt your head back slightly, close your eyes. So you're going to be like you are now, head back, eyes shut. Okay? When I tell you which hand to move, you must touch the tip of your nose with the tip of that finger. And then lower your hand once you've done so. Okay. It's down there, head back, and you're going to come up and it's tip to the tip.
Okay.
Yeah. Do you understand?
Understand.
Do you have any disability or medication prevention participating in this test? Okay, tilt your head back and close your eyes. Okay, right.
Field impairment tests must be completed when lawfully requested. Stay calm, listen carefully to instructions, declare any relevant medical condition, and do not argue roadside law. If you feel drowsy, cognitively slowed, or unsafe, do not drive. Prescription does not override impairment.
Left. Right.
Although the officer found this driver to be impaired, they did not consider the impact of their disability on their ability to conduct the test. The prosecution must prove that you were driving whilst impaired and not base prosecution on perceived impairment because of a disability. At PatientsCann UK, we stand for patient rights, legal clarity, and responsible use. Know the procedure, understand your obligations, declare your prescription, declare any disability, and only drive when safe.